So what is the purpose of chiropractic care in pregnancy? The purpose is to create the healthiest environment for a growing baby and also to help with a smoother birthing process for mom and baby. Now there are three components when it comes down to having a smoother birth. The first one I talk about, which is the most important one, is the power. So what do I mean by the power? It's the nervous system. So our nervous system is comprised of two things: our brain and our spinal cord. Our brain sends messages down through the spinal cord, out through the nerves, into every cell, tissue, and organ. That's why it controls and functions every process in our body, including the childbirthing process. Now we know with pregnancy that there are structural physiological hormonal changes that can put pressure on through the spine. So when we put pressure on through the spine, this can lead to nerve interference in the body. Now with nerve interference, this can lead to dysfunction in the body, which can cause complications and problems during pregnancy. So that's why our goal as chiropractors is to actually help remove the nerve interference in your body to help restore proper communication so that brain can transmit signals throughout to your body at 100%, which can lead to normal and physiological natural birth. Now, power is number one, but it's also important to think about the passage. So what I mean about the passage is the baby, right, needs to descend from the birthing canal, and the most important part is the mother has to have a balanced pelvis. Having a balanced pelvis will create a good environment for the baby. Now, during pregnancy, we have hormones running through our bodies, and the hormones are intended to help relax the body. Hormones relax the ligaments. Estrogen helps relax the joint capsules. Progesterone helps decrease smooth muscle tone and helps relax the effect of the structures. With chiropractic care, this helps the muscles and the ligaments, the pelvis and the uterus to help it move freely and help function better for the betterment and benefit of the mom and the baby, which can actually ease into greater results for comfort through pregnancy, the pregnancy and the birth. So passage is important, but we also want to talk about the passenger, the baby, right? So the baby is important for normal delivery. So with chiropractic care, not only having a optimal functioning nervous system and having the pelvis balanced, but the baby, it's shown that with chiropractic care, according to the Journal of Manipulative and Physiological Therapeutics, that there is an 82% success rate for a normal delivery where there's head first facing backwards with chiropractic care. Now, of course, without chiropractic care, that means that you can have more abnormal deliveries, which can lead into breech, which is the bottom here, face, or the shoulder. So goal with chiropractic care is help to bring the baby into the world in a normal process and delivery for that smooth birth. Now with pregnancy, the normal posture we see is gonna be this posture here. So what happens is you're gaining about 35 pounds of weight. That's for normal pregnancy. Now you gain this weight, but what happens is you increase the spinal curves here on through your back, which can also tighten up the muscles, can cause fatigue, it can cause pain. It can pinch a nerve, which leads to sciatica pain, can swell up the ankles. Not just that though, but the increase in the weight of the breast can pull the shoulders forward. Increase in spinal curvatures at the neck can cause tingling and numbness in the fingers. So that's why it's really important to have chiropractic care, because the body is going through a lot of changes and also can just bring you a lot more comfort throughout this process. So with the benefits of chiropractic care, decreasing nausea. So you'll notice in the first 12 weeks throughout the pregnancy, you're gonna feel a lot more nausea because you have a surge of hormones in your body. Now, with the surge of hormones in your body, chiropractic care helps decrease the nausea, but also help function the digestive system. We saw that easier labor time and delivery through a optimal balanced pelvis. So patients who had their first pregnancy, there was research that showed that there was 25% decrease in labor time, and the patient that had more than one pregnancy, there was a 31% decrease in labor time. Of course, chiropractic care can help with decrease with pain, as we saw on the previous slide with posture problems, and then decreased chance of C-section or breech baby from the passage and the passenger. So, I mean, overall, guys, chiropractic care gives a healthier pregnancy throughout. There's so many great benefits, but I know what some of you guys are thinking, is it safe to get adjusted? So when it comes to safety, there are no known contraindications when it comes to getting adjusted during your pregnancy. Actually, all of our doctors are trained into treating pregnant women and in babies. And so you're thinking, when is it a good time to get adjusted? Of course, right as you're getting born, throughout the entire rest of your life. But for pregnancy, if it wasn't then, it's now. It's now. So there's no better time to get adjusted during this time, when you are pregnant. And the technique is different too when you're pregnant. So we do use a safe, gentle technique called the Webster technique, which is very effective and safe, and there's a lot of great research behind this technique. We also have pregnancy pillows in the office for the comfort for you guys. And so when it comes down to having a good environment for the baby and helping out having a smoother birth, we are here for you guys to give you guys the information and to be here for you guys through this journey.